Welcome to Psych Waves, where we review emerging and current holistic treatments in psychiatry while learning to better understand the workings of our own minds. I'm your host, Dr. Teresa Anderson, owner and practicing psychiatrist of the Anderson Clinic in Cincinnati, Ohio. So today we'll be discussing a relatively hot topic in recent psychiatry, genetic testing. There are so many patients who suffer with treatment-resistant anxiety or depression. Many clinicians, not just psychiatrists, but frequently family doctors and internal medicine doctors, are searching for answers in a patient's genetics when every medicine they try either doesn't work or has horrific side effects for a particular person. What does that look like for the patient? That's what we're going to be discussing today. So you go to your doctor, you try a medicine, it doesn't work. You go back to your doctor, you try a different medicine, but it kills your sex drive or makes you gain 20 pounds and causes brain fog. You try a different medication and yay, it works, but then you increase the dose and it causes a rash or an elevation in your liver enzymes or causes you to not be able to sleep. So your doctor recommends something along the lines of genetic testing, and you as a patient thinks, yay, this will tell me the medication that is tailor-made for my genetics and it will work and I will feel awesome and I'll have little to no side effects, except not so much. What many primary care docs are unaware of is the fact that genetic testing for psychiatric medication coordination can be helpful, but it's certainly not the be-all end-all. And so why do I say this? Well, we need to be educated about what current genetic testing can provide us information about and what it cannot tell us. It's a relatively easy test to perform. It can happen in office, just requires a cheek swab, no blood required. And so whenever you take a psychiatric medication, it's typically metabolized by one of two places in the body. It goes through the liver, it's processed by the liver enzymes, and slightly less commonly, sometimes the kidneys. So right off the bat, we could say, if you suffer with a certain liver or kidney disease, we know for sure that these medications should not be prescribed to you. That we have. Especially in the liver, we're all born with a different subset of enzymes. And so if you have a large amount of one particular type of enzyme that processes medications and poisons and all this other kind of good stuff, you may be a rapid metabolizer of a particular drug that uses that enzyme to get through your system. Therefore, you may need a larger amount of that drug than the general population because your body processes it too quickly. You have an overabundance of that enzyme, so they're working hard. If you have a small amount of a particular liver enzyme type or don't have it at all, you'd be considered a slow or non-metabolizer of certain drugs. So medications that use that enzyme to be metabolized in your body may need to be given at either smaller doses or titrated more slowly, because your body may hang on to that drug for a longer period of time. And so either its drug or its active metabolite, it may hang on to a little longer because there may be a backup in the train there. So it may be a case when you shouldn't even be taking that drug at all if you don't even have the enzymes to process it, and that could cause toxic side effects downstream. So these medications would hang out too long and cause problems and very likely side effects. Certain psychiatric medications are targeted to specific brain receptors as well. So if you don't possess these particular brain receptors or have them in low quantities, it would make sense that those drugs that target those specific receptors likely would not work for you. So what genetic testing tells us is threefold. One, it tells us what type of liver enzymes you have to process different types of drugs. Two, it tells us what types of receptors in your brain that those different drugs may target. And three, it cross-references what you have and what you don't have in your body in relationship to what psychiatric medications are available on the market, how they're processed, and what target receptors they hit. So when the patient and the clinician get a readout of the genetic testing that was done based on your own results, it will typically show up as certain psychiatric medications are emphasized under a green light, a yellow light, or a red light, just like a traffic stop. Let me pause right here. Because what most people believe, just from a psychological perspective, green light means go. That's great. This means this is going to work for me. This is going to be perfect and it's going to be great. But again, hold your horses for a second, because sometimes people look at the red lights and in essence say, oh my gosh, half my medications are on the red light, I should stop taking them. Also not true. Both of those interpretations would be a mistake. The only thing that a green light means in genetic testing, just like a traffic stop, is that you are safe to take that medication based on your liver enzymes, based on your brain receptors that are cross-referenced with that particular medication. You are safe to take it. That doesn't mean you should. And that doesn't mean it will work. Let me repeat that again. Just because a medication is under the green light doesn't mean it will work, and it doesn't mean you should take it. All it means is, of all the medications listed, the ones under the green light are the ones least likely to cause you nasty side effects or problems down the road. Just as a yellow or red light doesn't mean you should not take that particular type of medications. There are lots of reasons those medications show up in that category. One reason would be that you're a slow metabolizer of a particular drug. That means that your clinician should start at a low dosage and move very slowly, monitoring for side effects, and more frequently than you would be if you were taking a green light drug, so to speak. Another reason a medication could show up in a yellow or red light category is because you are a rapid metabolizer of a particular drug. And that means your clinician should feel more comfortable escalating the dosage more quickly if you are not having a response, since your body gets rid of it more quickly than the general population. Now, when a drug shows up in a yellow or red category because the computer says it doesn't know how you metabolize it, I tend to avoid those like the plague personally. I can't make any recommendations to other clinicians out there, but it feels sort of kind of like you're playing Russian roulette with how you're going to respond, and I don't like that at all. So, all in all, genetic testing can be a helpful tool when a person hasn't responded to multiple different medication trials or has had nasty side effects to many drugs. However, please note that the test itself could cost upwards of several $100s, and not all insurances cover the cost of it. So it's good to have the most information possible and educate yourself as best you can so you can empower yourself to make an informed decision. So if you found this information helpful, please like, subscribe, and follow us. Tell your friends. And if you happen to be in the Cincinnati area and you're looking for assistance with treatment-resistant depression, anxiety, PTSD, or concussions, give us a call at 513-321-1753, or check us out at www.andersonclinic.net, or we are at Anderson Clinic Cincy on TikTok. Start feeling better faster.